Hi there, it's Dr. Patricia Coughlin talking to you about how to get better at what you do as a psychotherapist by increasing your knowledge base, developing your skills, and also facilitating your own personal and professional growth. So coming here, listening to these videos is part of that. Reading, getting supervision, looking at the videotapes of your own work. Doing these things consistently are all going to help you increase your effectiveness. I've been getting a lot of feedback and questions about this whole issue of psychodiagnosis. How do we make an accurate diagnosis? How do we formulate the case dynamically in a way that's going to guide our treatment strategy? This is really important, and I'm glad that people are responding. It's important that we evaluate the patient's strengths and capacities as well as their difficulties. And it's this balanced view of the patient that's going to give us a more accurate sense of how they're put together, whether they have a neurotic structure. In other words, these are people who have high capacity and function very well in most areas of their life. Self-care, friendship, schoolwork, such and so. But have one specific area of conflict where they get into trouble, like in love relationships or somehow getting into conflict with authorities. So these are people that we would consider relatively healthy. They're on the left side of the spectrum of psychopathology, and they can really use Davenlou's standard technique. This is the 20% that really respond to almost anything, right? Because they engage actively and readily. They see you as helpful. They don't put up resistances in the transference, so we don't have to worry too much about them. Then we have that whole category of patients who have character disorders. So what do we mean by that? Patients who have character or personality disorders have conflicts just like neurotic patients do. But whereas the neurotic only has these conflicts activated, again, in a very particular situation, like in love relationships. And in the face of that, they might take a loser position. They might undermine themselves in their quest for love and in going after the person they really want. But if that bleeds over into what we would call a passive avoidant character, then those defenses have lost their specificity, and the person is in a defensive position most of the time, so that their passivity, compliance, helplessness, tendency to take the position of a loser and see themselves as a victim is going to affect them in every area of life, from self-care to relationships and their work life. So those folks are going to need more work on defenses, which left unattended will become a resistance in the treatment. And these are the folks who really need a lot of defense restructuring and require the restructuring procedure that was developed by Davenlou. So easily 80% of our patients fall into these two categories, the neurotic and the character disorder. And if you're an ISTDP therapist, then that means you're going to be using either the standard or the restructuring technique. So when it comes to then assessing patients who we would consider fragile, who have low ego adaptive capacity, we have to make sure we have the data to support that diagnosis. And again, like I've said in other videos, it doesn't just mean that the person, when very anxious, might lose track of their thoughts or even get a bit depersonalized or dissociated. But there are other things we have to consider. What are their highest levels of capacity? Do they have the capacity to mentalize and to use repressive intellectualizing defenses? And do they only get, for example, over threshold and a little fuzzy when it comes to a really intense conflict? What is their capacity for self-care, for engagement with others, including you, for their work life? These are all things you want to take into consideration. To be considered truly fragile, we're looking at GAF scores, that's the general or the global assessment of overall functioning, would typically be at 50 or lower. So in other words, these folks can't seem to take care of themselves. They either neglect themselves or really abuse themselves in all kinds of ways. They also tend to seek out relationships in which they are used and abused, so they are victimized over and over again, and they tend to fail out of school and not be able to hold a job. They also have many physical problems and really just are not functioning in the world. So as you can tell by this illustration, you're not going to see too many of these folks in your private practice, but if you work in a clinic or a hospital setting, you're likely to see more of these folks, and they require ego building and a more graded approach to the work. That said, even folks with neurotic structures or a character disorder can have what I call pockets of fragility. Again, certain areas of functioning or certain topics or certain feelings that will evoke such intense conflict and anxiety that they regress to a weaker or more compromised position. And so you're going to have to intervene and build up their capacity to tolerate their feelings and anxiety without collapsing. And you can do that relatively readily because, again, they have strengths with which you can, partner and ally. So another one of the distinguishing characteristics between truly fragile folks and people who have higher capacity but can regress when anxious is how quickly they bounce back. So they might begin to drift off and you can see them glaze over and almost begin to dissociate. But if you grab it right away, what's happening right now? Can you stay here with me? And they're able to do that. Or they get anxious and start to hyperventilate, but you intervene quickly. Can they rapidly reconstitute? If so, again, they don't have a fragile structure. They have these pockets of fragility. I hope this helps to make some of these distinctions. It's extremely important because, again, we want to be intervening at the patient's highest level of capacity, and we actually want to block regression in patients who have the capacity to repress, to isolate affect, intellectualize, and so on. So if you have more questions or concerns about this vital aspect of the treatment, getting an accurate assessment of capacity and functioning, then please leave comments here and I will get back to you. Thanks. Bye-bye.